Trade in April 2019, where he's responsible for trade and investment relationships between Southeast Asia and the UK. He's based in Singapore and leads a team of 90 staff across the ASEAN-based British embassies and diplomatic missions. The role brings together the leadership of the UK trade promotion, trade policy, economic and finance. Prior to taking on this role, Sam was on a secondment to the pharmaceutical company AstraZeneca, where he was head of UK science policy and relations. But before I hand over to Sam, I'd like to do a little housekeeping. We'll start by the welcome remarks from Sam Myers, followed by a brief video. And next, we will have we will call each of the panelists to speak on their companies and make their interventions. Please do try and keep these brief, as we have a lot of content to cover today. Each of you have been shared panel notes to prepare 2-minute comments each. If you'd like to contribute in discussions, please raise your hand to attract my attention or any of the CWEIC will be on hand throughout the meeting to facilitate connections and introductions between the fellow participants. So please don't hesitate to be in touch. I'd like to take this opportunity to introduce Sam Myers and ask him to make his opening remarks. Sam.
Thank you very much, Nero, and good morning or good afternoon, depending on which part of the world you're dialing into from today. It's a real pleasure to be here to welcome you all to this really exciting discussion. As Nero said, Birmingham will host the Commonwealth Games between the 28th of July and 8th of August this year, and celebrating the run-up to those games, with today marking the 16th official Queen's Baton Relay. The relay began on the 7th of October last year, with Her Majesty the Queen placing her message to the Commonwealth into the baton. And it's now on its 294-day epic journey across the Commonwealth, where it will visit all 72 nations and territories. It was actually physically with me here in Singapore last week. It arrived into Malaysia on Saturday, and it will depart for Brunei after today. So the focus is on connecting communities, sharing messages of hope, solidarity, and collaboration. And I believe they resonate really well with the conversation that I hope we're going to have later on today. Now, if I can manage the tech just to prove to you that it has indeed made its way to Malaysia, this is, hopefully you can see the baton with His Excellency Charles Hay running through Kuala Lumpur. I got sent that photo today. I think that's just from this morning, so hot off the press. If you'll bear with, I will return back to a slightly less distracting background. So I'm really delighted that DIT, the Department for International Trade, has been able to partner with the Commonwealth Enterprise and Investment Council, truly brilliant partners for bringing together this and a select number of other business roundtables during the Queen's Baton Relay. Both of us really hope that one of the side benefits is that it shines a spotlight on the West Midlands and the UK and what it can offer for investment, trade, visitors, students, events and businesses. The West Midlands is a growing centre for testing and demonstrating health innovations, working with our brilliant National Health Service and in partnership with businesses and patients. The region's ambition is to build on its growing cluster, delivering improved clinical care and health outcomes alongside significant business growth and scale-up opportunities. For those of you able to visit Birmingham in person this year, of which I hope there are going to be many, there's a venue called the UK House in Birmingham that is available to host summits, government and business meetings. So please speak to my DIT colleagues to find out more. And why Malaysia? Well, Nero's already touched on some of this, so I won't go over the ground that he's covered. But the UK has a long established relationship with Malaysia, and trade really underpins and is central to that relationship. Two-way trade between our nations is worth around £5 billion a year, and Malaysia is the UK's second largest export market in Southeast Asia, with around 6,000 UK companies exporting their goods and services. We're of course keen to grow that even further. And so to that end, we've established a government-to-government joint committee on bilateral trade and investment cooperation. And that's working to create the right conditions for companies to trade with each other. And it's another area that if you've got ideas or you'd like to find out more, then please speak to the DIT team. Outside of the embassy and the High Commission structures, there's a really strong business footprint in the country from the UK, a wide range of investment, and just taking education as one sector to highlight, there are 5 UK university branch campuses, including the University of Nottingham, Heriot-Watt, and Newcastle University Medicine Malaysia. And linking with today's discussion, tech is very much a rising star in our relationship. And we've seen a wave of new investment from British tech companies such as Clarivate and Double 11. And we're seeing increasing numbers of British businesses succeed in the healthcare sector. 2 examples of that, My Way Digital have launched a diabetes management app with the National Diabetes Institute of Malaysia. And LiveSmart have launched a one-to-one health coaching app with AXA Insurance. Plans for further digitalisation of Malaysia's economy is driving that demand, and I hope those of you on the call today from the West Midlands will be interested to find out more. And 4 key trends to put on your radar include patient-centred care, virtual healthcare assistance, highly integrated data and platforms, and precision medicine. And there's lots of support beyond the CWEIC, but also into my team in DIT to help you succeed in the region. We've got Bhavna Vishkawana on the call, and she's our healthcare lead in DIT Malaysia team. And she's really keen to reach out and discuss further with you about examples, advice, support on the regulatory environment, partnership opportunities into the government and business partners, as well as providing her understanding on the regulatory and business environment. She works really closely with the British Malaysia Chamber of Commerce, who are really active in KL, as well as across the wider Malaysia, opportunities in Penang, Johor Bahru, so we can help connect you into that huge network across the country and indeed into the Southeast Asia region. So that's all I wanted to say to set the scene for today's discussion. I hope that your engagement, discussions and questions today will be just the beginning for those of you looking to explore further opportunities for collaboration and partnership. Thank you very much, and back to you, Nero.
Thank you very much, Sam, for your insightful comments. Before we proceed, I'd like to take this opportunity to play a short video from Mike Freer, MP, who's the Minister for Exports at the Department for International Trade.
In the summer of 2022, Birmingham will host the Commonwealth Games, the biggest sporting event the West Midlands has ever seen. And the Games are breaking records before they have even begun. They will be the fastest Games, delivered in 4.5 years rather than 7. The first ever carbon neutral Games, and the biggest Games, with the largest ever para-sports programme and more women's medals than men's for the first time. This will be the West Midlands moment. 1.5 billion people across the globe will tune in, creating a once-in-a-generation opportunity to showcase the region to new audiences. By working across the public and private sector, our business and tourism programme will enable the West Midlands to capitalise on the long-term economic opportunities generated by this global exposure. It will boost exports and attract inward investment, giving the region the shot in the arm required to recover from the pandemic. This programme is already delivering and is anticipated to create up to 900 jobs in the West Midlands, but its benefits will spread further. Another 500 jobs are expected to be created across the UK, and almost 1 billion of new overseas investment into the UK is forecast, whilst an estimated £12 million in extra visitor spend will provide much needed support to a tourism sector that has suffered globally throughout the pandemic. Through the Business and Tourism Programme, work with our Commonwealth partners will focus on 4 key sectors where the UK is already a world leader: data-driven healthcare, creative technologies, future mobility, and a modern business services sector. The programme will also support sectors including e-commerce, education, food and drink, and the sports economy. These games will bring so many nations together, allowing us all to show that we are open for business, open to partnerships, and ready to be at the forefront of global trade. By harnessing the opportunities the Games will bring, We will deliver economic growth and jobs of the future to the UK and the Commonwealth. And we hope that by working together, we can build this mutual prosperity for our countries. I do hope you all enjoy these prestigious games, and I very much look forward to welcoming you to the West Midlands in 2022.
Well, I hope that's got you excited for the games, as well as business relationships and friendships that can be forged around them. Please remember that there are members of our DIT team on this call who are keen to help you connect and build closer relationships in the months ahead. I'd like to now invite our speakers to introduce themselves and make a 2-minute intervention. Following the interventions, we will proceed to general discussions. If I may introduce the speakers to introduce themselves in order. First, may I invite Datuk Dr. Kuljit Singh, President, Association of Private Hospitals of Malaysia.
Thank you very much for the invitation, and happy that I've been given this opportunity to be with all of you all from Malaysia. I'm the president of the Association of Private Hospitals Malaysia. We have got 156 members, 156 private hospitals who are members in my association. There could be another 50 more smaller hospitals who are non-members. And I'm an ENT surgeon by profession. I still practice as an ENT surgeon. And at the same time, I'm the medical director of Prince Court Medical Center, which is a premier medical center within the city. If you know where the Twin Towers is, we are just probably less than 2 kilometers away from the Twin Towers. And well, we are happy to talk about digitalization, the progress that we have made in Malaysia. And also we are looking forward what else that we can do working together with the United Kingdom. Thank you.
Thank you very much. May I invite Professor Dato Dr. Noor Shahida Kairula, Medical Director of 23rd Century International Life Science Center.
Hello, everyone. Good evening from Malaysia and good morning to those who are in the UK. Thank you very much for this kind invitation. I'm really excited to be part of the dialogue. 20th Century Healthcare International Life Science Center, our core business actually is immune cells as well as stem cells. We have a huge facility, one of the largest in Southeast Asia, to produce cGTP, cGMP products, mesenchymal cells in particular, as well as natural killer cells. The concept of our business is really to take it as holistic as possible, i.e. we actually look at both upstream and downstream interventions for patient-centric healthcare. I mean, there's lots to tell, but essentially that's our core business. We do a fair bit of research, especially with cancer patients as well, and looking at interventional integrative oncology, as well as to be looking at certain novel treatments of part of the immune system.
Thank you very much. May I invite Puan Amana Shari, Group CEO and founder of Serunai Commerce.
Yeah. Thank you, Neha.
I hope I pronounced it correctly.
Yeah, Amna. Right.
Amna. Wonderful.
Yeah.
Thank you.
Hello, everyone. Thank you for inviting me today. Serunai we are a digital company where we really focus on halal and also from vegan and organic. And we do full traceability of food, pharmaceutical, beverages and everything, all the processes and all the ingredients, and full traceability, which include all the blockchain and the processes internally from in the company. Halal itself, at the moment, is our core thing that we are doing, because we've been empowered by Islamic Development Bank HQ, as now we are onboarding a big way to help the government of Indonesia and actually Malaysia, and of course all the OIC countries. And of course, Commonwealth is close to our heart, not only because we are Malaysia, but a lot of the country around the world are, of course, in Commonwealth countries. And this is where we're also embarking into all this, like UK and Africa and many more. So for us, we really excited because pharmaceutical drugs is become more and more complex with all the interesting ingredients. And we are tracing across the board and the supply chain, who are the suppliers and also the processes in the company. So anybody who's interested, you're welcome to talk to us. Thank you, Nero.
Thank you very much. May I now invite Surya Gandhi Supaya, Chief Operating Officer of KPJ Healthcare.
Hi, it's good evening. It's evening in Malaysia. I think it's morning in the UK. I'm the Chief Operating Officer of KPJ. KPJ is the biggest healthcare group in Malaysia. We run 28 hospitals, going to be the 29th in the middle of this year. We have close to 15,000 staff under our payroll, and 5% of our business come from non-hospital business, which is in relation to support services for our hospitals, as well as we also run a university that trains nurses and also run programs for healthcare as well. We are a 40-year-old organization. We are currently in the process of a huge transformation for the group. And our transformation is it's called Star 25, which is we hope that by 2025 we are able to do all the changes that we want and get KPJ to where we need it to be. And Star stands for sustainability in terms of being involved in a sustainable way of doing business, as well as for it to be a sustainable business. Technology, T in terms of technology. A is that we are with that, we also want to have an agile workforce that allows us to do the things that we want to do. And as a result of doing all that, for us to be a very resilient organization going into the future. So that's what our Star 25 means to us. So technology and human capital is in the center of our transformation. And I'm really looking forward to this dialogue today, because there's a lot of topics that are quite interesting, and to also to see whether there are opportunities for us to collaborate with companies here as well as in the UK as part of our journey to transform KPJ. Thank you.
Thank you very much. May I now invite Tiago Vanugopal, Malaysian Investment Development Authority.
Hello, everyone. Good morning, UK, and good evening, Malaysia. So firstly, thank you very much for CWIC and DIT for giving this opportunity. So quick introduction about MIDA. So we are principal agency to attract and promote investment into Malaysia. So the London office covering the UK and Ireland. So our core duty is basically in the manufacturing, also healthcare sectors, including these services, including healthcare sectors. So we encourage UK companies, to look into Malaysia, not necessarily in the hospitals, also as a supply chain. So where you can, place your services. In this, the most promoted, the two promoted things that we do at the moment, which is private hospitals and also the ambulatory care center. So we invite the UK companies to look into this. We are here in London. You can come and meet us anytime. We're welcoming you for further discussion. Thank you.
Thank you very much. May I now invite Professor Patrice Bossier, International Medical University.
Yeah, thank you. So I'm representing International Medical University because Prof. Vishna could not attend this meeting. Prof. Vishna is the person in charge of international relations at IMU and also in charge of new programs. And IMU is one of the top private universities in Malaysia and specialized in healthcare. And this year we are celebrating the 30th anniversary of the creation of the university. So I've been with IMU for 2 years now, and IMU is now engaging in digital health, and we have started a Master in Health Informatics and Analytics in September. I'm the program director for this program, and we are going to start a Bachelor in Digital Health in September 2022. And we have already started working with foreign universities and companies. We are in contact with Imperial Medical Solutions in UK, TPP and DMA. We have not done much at the moment because we just started our programs and we have our first batch of students who will do their research projects soon. But in the future, we will probably do more. Imperial Medical Solutions is the one we are working more because they have a branch in Malaysia, so it's easier for the moment for us. But we hope we can do more with other companies later. We are also talking at the moment with a few universities in the UK. Recently, we were talking to UCL. We have talked to Warwick, not Birmingham, sorry, Manchester, and also Strathclyde. So hopefully we will sign some agreements with some of these universities soon, so that we can do more in terms of joint programs, joint developments, and research, hopefully as well. Thank you. We cannot hear you. You are muted.
Perfect. It happens to me, right? I'd like to now take this opportunity to invite our speakers from the UK. First, Byron Dixon, OBE, CEO and founder of Microfresh.
Good morning all, and good evening to you guys in Malaysia. So my name is Byron Dixon. I'm the CEO and founder of Microfresh. We're a global antimicrobial brand. That's what we do. You can see us mainly in retail stores, typically in John Lewis in the UK, in bedding, and we stop bacteria growing. We're now starting to do a lot of work with healthcare because talking about hospital-acquired infections, and also our product has been tested in the UK under the UK government against the efficacy against COVID. So Microfresh into textiles prevents the growth of COVID on textile surfaces. We are a current global export champion, so we're very proud of what we do. Everything we do is made in the UK, and we ship to over 60 countries. And as a company, we are also official UK government export champions. And that's my introduction.
Thank you very much. May I request Debbie Wake, CEO and Chief Medical Officer of My Way Digital, to make our introductory remarks?
Yes, thanks very much, Noor. Good morning. So I'm Dr. Debbie Wake. I'm a diabetes physician by background, and My Way Digital Health is a spin-out company from Dundee University in Scotland. We spun out about 5 years ago, but actually we've been non-commercially running the National Diabetes Platform in Scotland for about 15 years. Since spinning the company out, we deliver software platforms for long-term conditions with a focus on diabetes. We now run national diabetes platforms for both Scotland and England. And data is at the heart of what we do. So we essentially pull in data from electronic health records and remote monitoring devices. And we use data to personalise and tailor systems that support both patients to directly self-manage their condition, right through to clinician decision support systems and population analytics risk triage platforms. In terms of Malaysia, Sam mentioned us briefly in his introduction. We're just starting a project in Malaysia with a number of partners, including the University of Dundee in Scotland, but Sesame, BMZ Technology, the National Diabetes Institute and the Ministry in Malaysia. So hopefully our diabetes app will be available in Malaysia from around about April time. And we're looking forward to basically growing in Malaysia. We already have an office in Dubai as well, and the Middle East is another big focus. And unfortunately, I need to leave quite soon today on the call, but Andrew Meikle is our international business developer, and he's also on the call and will be able to answer any questions. Thanks.
Thank you very much. I'd like to invite Neha Vitaldas, Global Relationship Manager, Aged Care Technologies, please.
Thank you, Nero. So I'm the Global Relationship Manager for Aged Care Technologies in the UK. And what we specifically do is it's a digitized assessment tool. That's our core product. So we help determine health related problems for old age people. And we majorly deal with B2B. So we have to act with government organizations like Suffolk, Cornwall, and many more adding to the kitty. So we help determine these problems so that can be tackled and dealt with. And there is less load on the care system as a whole. And we are also an award-winning assessment, which is in line with the WHO and UN ICOPE framework. So our vision is to improve the quality of life adding one extra life to an older person, and thereby also saving the operational cost for the medical systems. So we are a global organization though, and we are also present in Malaysia. And that's more about aged care technologies. Thank you.
Thank you all for your introductions. And now on to the core of why we're all here, is to discuss the opportunities to increase trade and business partnerships between the West Midlands, the wider UK and Malaysia around the healthcare sector. My first question is, the healthcare sector in many Commonwealth countries is still emerging. How can Malaysia and the UK health tech companies collaborate to help shift the emerging world's healthcare systems towards a data-driven system? And where are the challenges and what are the opportunities? I'm going to open the questions with Dr. Debbie Wake and Surya Gandhi Supaya. Dr. Wake, would you mind addressing the question first, followed by Mr. Supaya?
Hi, Nero. I believe I'll take over from Debbie as she's had to get off the call. If you don't mind.
Absolutely.
So in terms of the challenges, I think for Malaysia at the moment, I would say they're mostly cultural, language, regulatory differences, and also differences in the healthcare delivery model. Opportunities-wise, there are definitely key synergies there between us in terms of data-driven healthcare. Chronic disease management, which is the area that we come from, is pretty similar globally. So we see a lot of synergies there. And of course, lots of excellent products and models where there are opportunities for collaboration and commercial endeavors, really. So yeah, back to you.
Surya Gandhi, would you mind addressing that?
Yeah, I think the opportunities, I think if we were to look at it and we'd assume that UK has a strong, well, not assume, UK does have a strong healthcare background in terms of the things that they've been doing and in the forefront of a lot of the things which is healthcare related, right? And in terms of using technology and the apps for us to collaborate between Malaysia and Singapore, I think there are a lot of learnings or experience that these medtech companies from UK can come and bring along with them and share it across in Malaysia. For example, as what Debbie and her team is working on this diabetic app. Diabetic problem in Malaysia, it's a huge problem. It's probably the same in the UK, it's similar in the Middle East as well. So that's something that, again, how do you use that data to help for us to, it can be two ways, right? One is you use that data, maybe that there's a data in the UK, which Dundee University, I'm not sure what sort of data they're collecting. But if they are collecting data, then there can be two things that they can do. One is helping to say that once you have this diabetic problem, what are the health support that can you get through that, right? Because you in the app, you will be able to do that. On the other part is that once you have enough of this data, how do you then use it for more preventive, as to like what sort of things that happen before someone becomes that, and so what are the steps that they can do? So the data starts to become bigger, and the data starts to become real, and it doesn't only end up being a very diabetic kind of information, because you start to share it across. How does this, because diabetic data you can be shared across to say that how much of this data then impacts someone's eye. So our ophthalmologist becomes relevant in terms of getting this data as well. So in many ways, a starting point, something like diabetes that has a connection to a lot of other diseases as well, is a good point to bring into Malaysia and to help us start off, because diabetes is a big problem for us in Malaysia as well. So that's something that we would definitely find it relevant. And the other thing that's important, and I think that's something that if UK is already advanced in, that is similar to what Debbie's company is also doing and working in Scotland and in UK, right? It's that in Malaysia is that PDPA, that Personal Data Privacy Act thing that we have. And how is that information of all these patients protected in sharing and using that data? How would they then use this to ensure, what sort of safeguards are they putting in place to ensure that all this data is not compromised? So are they actual data sharing in terms of different agencies? How do they share that data? I think that would be interesting if they were to bring it across to Malaysia and say that this is something that we've worked on in the UK, and this is how we can bring this across, and this is how we can protect the data, but at the same time, this is how we can mine this data and it can be useful for everybody to use.
Surya Gandhi, you're encroaching a little bit on my next question, but if I may ask Neha to comment on the first question, which is the healthcare sector in many countries, Commonwealth countries, is still emerging. How can Malaysian and UK health tech companies collaborate to help shift the emerging world's healthcare system towards data-driven health? Where are the challenges and the opportunities? Neha, if I can ask you to comment on this,
sure.
Given you're looking at aged care technology.
Sure. So aged care technology is anyways a global organization. So we are working across the globe, trying to help the government as well as the care systems deal with the data as well as the healthcare problems. And majority of the understanding comes from what we have done. So that data analytics plays a big role. And that is what we have understood. To understand the problem, we need to understand where it is coming from. Unless you understand the core of it and the relevance of it, it's difficult to tackle it. And that is exactly what even the NHS system in UK does. So because it's a centralized care system, it's easier to understand the data as well. So that is what we are doing. But what aged care technology is also doing is tying up with different parts of the world for helping with the care programs. Like, for example, the Japan and China and Malaysia as well. So we are dealing with that by partnering with them, because every country will have a different way of administering the care facility for the population. So it's important to also customize it for them. And the data, yes, like my colleague Surya Gandhi said, that it's very important to deal with data with utmost care, as well as it's maintaining its confidentiality, and using that data is important. But there are different ways how it works for us. So, but these are generally what we follow, but unless you want me to deep dive into something.
Well, actually, our next question is specifically about data protection and privacy laws, and the question is for Professor Dato, Dr. Noor, Shahida, Kairula, as well as yourself, Neha. So please, both of you, please feel free to answer the question, which is, what are the key challenges faced by health tech companies when expanding into new markets? How can the private sector work with the government to develop a balanced legal framework that protects citizens whilst enabling business, with specific regard to data protection and privacy laws?
One of the concerns that we have, actually, thank you, Neha, by the way, we are trying to have a focus on my health data. This is for specific patients because we are into personalized medicine. Even though the core business is really looking at how effective stem cells are, actually been proven to be very effective for a long time, and immune cells as well to mitigate and heal some chronic diseases. When the data gets transmitted, we have patients all over Asia. Data gets transmitted in terms of the patient's personal data plus the results itself. I think once you expand the business, you have a greater patient load, and then we have my health data where it's kind of a linear system from the center to the patient, is how to protect that when we actually have engagements with other international companies. Obviously, this is something that is crucial because we want to expand our business. And for me personally, right now, the stem cell market is emerging and it has been growing and growing. But the only factor that's hampering is business in terms of a bigger share, at least in Asia itself, is really the cost. So if we can partner and make the treatment more accessible by networking and also collaborating with international companies in the UK, for example, who are keen to venture into personalized healthcare, more of the wellness industry compared to the sickness industry of the hospital, which will save the government billions of ringgit. And really, if you look at the healthcare system, a lot of people now, majority of people are shifting towards preventive healthcare. No more of the curative healthcare because it doesn't work. And part and parcel of it is lifestyle modification. Now, in trying to fulfill those requirements, there are details for patients that we need to disclose. For example, I just give you an example. In Points, we have this government app called My Sejahteraan. They developed this app to mitigate COVID. But in this app, there's a lot of personal data from your own demographic data to how many people you have in the family, and if you do have COVID, when, and what are the test results like, etc., etc. And they assure that there is personal data protection. As to how they do it, we don't know. I think this is where the contention is. It's always stated there is personal data protection. Our challenge is to work with the government sector, which is a huge bulk of the stakeholder, to actually enable and reassure participants, i.e. our patients, that their data will be protected. And also make it like a repository of data, but this repository of data has got data health protection. And this is one of the biggest challenges, at least for us, when we see in terms of collaborating or expanding businesses with other companies.
Thank you very much. Neha, do you have any comments on that specific subject, or can I open the same question to the floor?
Maybe just a line for us.
Sure.
So just to go, usually the challenges are aligning to different like data privacy, legal and laws. So aligning with that is very important. And that's how generally what we do. The floor is open.
May I open the question to the floor? If you'd like me to repeat it, I'll be happy to do so. No takers? Okay, I'll move on to the next question.
Maybe I can, yeah, because we are teaching our students that, because we are teaching health analytics, data analytics, and we tell our students that 80% of the work on data analytics, in fact, collecting and cleaning data, preparing the data, organizing them. And yes, we know that we have a lot of problems. Data interoperability is one of the biggest issues, and because of the protection of the data, we cannot really do it at the moment. But it's one of the biggest issues everywhere in the world, in fact. Huh? But so in Malaysia, we have a few students. One of them is working in for the Ministry of Health. But even like this, it's not so easy to get data. And in fact, when we want our students to work on data sets, we go to internet and we, for example, we go to Kaggle to get data sets. So yeah, this is really a big problem. I'm not sure how to solve it at the moment, but it involves a lot of actors. Yeah.
Thank you for your thoughts on the subject. If I may move on to question number 3. Many health tech firms are startups, small companies innovating and disrupting more established companies and industries. What are the special requirements needed by this sector to grow, commercialize, and internationalize, and form international partnerships? If I may ask Dr. Kuljit Singh, President of the Association of Private Hospitals in Malaysia, to address this question first.
All right, thank you very much. I think one of the main reasons sometimes digitalization doesn't take off in a very fast manner is because of the cost of digitalization sometimes is not affordable for some of the smallest stakeholders, especially in Malaysia. If you look at the smaller hospitals, private hospitals, they are still using the old way of running the hospitals by using pen and paper and putting records on paper. And this is because of 2 reasons. One is because of the cost. And of course, number 2 is to transform data that they had in the past into a digitalized version may hamper their day-to-day practice. So they seem to be a little bit reluctant. So if there are startup companies or even innovators that can come up with something that is affordable. Of course, affordability is very subjective. What is affordable? And we need to look at something that can encourage the small players to go into digitalization. And even the government of Malaysia has been trying very hard to digitalize all the medical records, and also making every public hospital using a digitalized platform. But I think one of the reason it could be is also because of cost. So every new private hospital, every new government hospital today, it is a fully digitalized hospital, but there are so many of them which are not digitalized, and they are old hospitals, and if they ever digitalize, it's all fragmented. Maybe some part of it, that what they can afford, they will do it. Maybe the pharmaceutical side, or maybe some part of the procurement, but not the entire thing. So if there are efforts on that direction, I think then you can see the pickup rate of doing digitalization will go up. We need EMR. I mean, electronic medical records is nowadays like, you should have it. But we don't find it in a big way if we really go down to the dollar. So I know that's the main stumbling block that we see whenever we go down and ask people, hospitals, why don't you digitalize? And it's actually the cost.
Thank you, Dr. Singh. Byron, may I ask you to comment on the same question? If you'd like me to read it again, I'd be happy to do so.
Yeah, sure. I'm off mute now. Yeah, I mean, we're a biotech firm, so our product goes into fabric and textiles and stops microbes from growing, which is great in retail. But then when we interact with healthcare, typically, we are an SME. We're not a startup. We've been going for 15 years, and we're a global business. But when we interact with healthcare, there's a huge amount of regulation. There's a huge amount of blockers. And that can be a problem, because what we think is really simple, innovative technology, because of all the gatekeepers, can end up not being used. A model that is used in the US, especially with companies like Kaiser Permanente, if anybody's heard of them, is they actually work with innovative companies to help you either standardize or interact with their procurement teams or get the necessary regulations. So they have a vehicle where almost startups or companies with very little turnover can pitch to Kaiser Permanente, and over a period of weeks, months, even years, they will coach them and grow them so that they are ready to interact. And that way, they keep innovation within a huge corporation. In the UK, it's very different. Dealing with the NHS, we hit a brick wall. And of course, in business, there's much lower hanging fruit. So I think, to answer the question, special requirements for this sector to grow, and I'm talking about biotech, but of course it would apply to any tech, the kind of things you guys are talking about today, is to think about what the companies have that they're bringing to you, and to look at them not just as an alternative to typical blue chip £100 million competitors, but have a vehicle where you can help them to grow, to talk to them and help them to grow their product. So I think that's a conversation I'd like to have offline with Dr. Singh about working in Malaysia, and a couple of other people, which I'll send you private messages. But yeah, I think they're the sort of things that maybe should answer that question.
Perfect. Thank you very much. May I open the floor to anyone who'd like to comment on that question?
I like to, Neera.
Please go ahead.
Yeah, so actually we work with many SME and small companies. We do full traceability for healthcare and drugs, and we have millions of data. We are a big data company, and we do many analytics. So to answer back your first question, is about calibration. It's about wanting to calibrate and consent to a certain level what can be revealed or not in halal, and also in vegan and all that. You have to be halal. If not, you cannot be part of the ingredient supplier. So and to find a specific ingredient around the world with specific pricing, and also the processes must be correct for the MNC, for the multinational to adopt and to buy, has to be very clear and very open. So in our apps, we can, with the consent of each party, we can open it. So it is a complex thing. So this is where the SME are encouraged, in Malaysia and also Indonesia now to do the digitization, which is supported by the government. It's also supported by private sector, all the ministries from Ministry of Education, SME, entrepreneur, even Islamic Development Bank, even the private sector, and contributing not only financially, but also how to do it because it's never been done. So back to how the small can grow. Yes, they need a lot of support, but at the same time, the big corporation has to teach them also what needed for the SME to supply to them, because if not, they will not have the chance. And also how the SME is visible to the world, because you're not only selling to one SME, you want to sell to the world. So these are the collaboration around the world, in this case in the UK and also all the Commonwealth countries need to happen. And there should be a body to govern this. So for us now, we're working with so many countries, 50 countries. So imagine the legality, the consent. In fact, some are very snobbish and doesn't even want to even share. They can be small, but they feel they're unique. They said, no, I'm not going to share. So these are other things that dampen some of the connection because some MNC have thousands of ingredients. Now we're doing 2,000, 3,000 for specific product, even on drugs, they have hundreds. So back to the SME micro, innovation is important, visibility is important, but at the end of the day, I do believe that there should be an umbrella, the government or somebody to really oversee in order to make sure the calibration happens. Sorry, Nero.
No apologies necessary whatsoever. Thank you for that comment. Go ahead, Dr. Noor.
Yeah, thank you, Nero. In addition to what Amna has said, I keep on thinking about business matching because you're talking about smaller companies, SMEs trying to grow. Just take 20th century, for example, healthcare industry in terms of stem cells. It's a niche portfolio, but the business matching, you're going towards digitization in the end anyway, right? In order to expand. So niche matchmaking of companies, can't speak now, very hypoglycemic, I think, end of the day, as to, and get a mentoring system done. Because when you're working with the government, it's a very tricky business. I think Byron has alluded to that. We always go against a brick wall. There is this push and pull. They are encouraging by giving certain felicitating methods to actually get digitization of your healthcare business. But at the same time, there's so many layers and processes and blockages. So if a bigger company in the UK, for example, is matched to a smaller company with the same agenda, a niche business to digitize and actually promote healthcare business towards personalized healthcare and preventive health, perhaps the two can merge and approach the respective governments to give them a leeway, a platform, at least to start something. Because if you don't start anything, it'll be the same vicious cycle. And this is what we face. We know that the Ministry of Health Malaysia has got certain platforms. They have their respect to COVID, they have the My Sejahtera, the National Health Labs have their own information system. They also have the e-COVID system. But the flow is one way. We provide information, they take it, and then they actually crunch it to try and mitigate the COVID problem, the pandemic. But in terms of giving back to us, we can't get the data. Dr. Kujit alluded to this as well. Even though we want to get data, we have to go to the internet to search for it. Because if I were to write letters to get certain data from them to assist in my healthcare facility to promote better healthcare for the patient, i.e. Maybe a plan for prior to a cardiovascular event, what are the programs our patients can actually join in order to have a preventive lifestyle? We have to go to the internet to get there. If you were to write a formal letter, it just goes on and on. You have to contact many people and sometimes even difficult to pinpoint who is the contact person. So where I'm coming from is really frustration in that order because I think that we are small. A lot of us who are interested are small. We need a bigger sister or brother to come with us to join and tackle this. It's not difficult. It's just talking and have a common platform to discuss and move from there. I'll give you an example. Like we have a patient from Indonesia. Okay, so in order for us to crunch the data to lead to personalized healthcare and specific treatments it has to go through Indonesia, but their healthcare system is very different from ours. And stem cells and immune cells is not one of the registered product in the regulatory authority. So the patient will have to come to Malaysia, but when the patient wants to come to Malaysia under health tourism, they have to state the reason why. And even the Ministry of Health Malaysia, they're still toying about how to actually register these products. There are ways they are starting to put in place, but it's just taking too long. So that's the frustration. Is the need and the time.
Some very real examples, and I think, specific, it's a specific ask from your side in terms of, amending policy, being able to be more conducive to the kinds of technologies that, each of the panelists here are trying to create and create the ecosystem for. Very interesting and valuable input. Thank you very much. The next question, and I think it also stems from your comments just now, is national level health information platforms for data sharing and analytics. How can data help provide earlier insights into pandemics, the needs during them, and the help the model and help model a path to recovery? This question is for Professor Patrice Boursier, and if Andrew Mikhail, if you could answer as well.
Thank you. Yeah, in fact, I already replied to this question partly because, we obviously need to have access to a lot more data. They have to be organized. It has to be organized by the Ministry of Health, probably. But personally, I don't have the contacts at the Ministry of Health for this. Hopefully, in the next few months or years, we will have this because of the position of IMU. I know that some of the professors in IMU, they have worked with the MOH before. And so I think this is something that we need. And I believe that there are some movements, apparently, the Ministry of Health at the moment, and it looks like they want to do something on this. But I don't know how it will work. I'm a bit surprised also that we have so many problems for collecting data, because when I was in France, I was an associate professor in France 30 years ago. I was developing an information system for a cardiology clinic in Paris. And we were collecting the data with the software system that I had developed myself. And I'm surprised that it's not done everywhere at the moment, because it's much easier to collect the data like this. So I'm surprised that people are still using paper and all the things. So we have to do something there. Maybe create a startup company in Malaysia. Maybe it already exists, I don't know, to develop some software for making it easier to collect all this data from the place they are created, in fact. Because if we need to transform audio and written, especially written data, especially by GPs, it's very difficult. It's very difficult to process this data. So maybe we can collaborate on some project, because I believe this is something that we should do in the future, to have collaboration on R&D projects between universities and companies in Malaysia and UK. When we were talking to TPP and other companies in UK, they said that they were working on big projects together with universities in UK. So hopefully we can do the same in Malaysia. Of course, we are a bit back in time, and IMU is the first university to develop these programs related to digital health. And we will, in fact, we have a research institute that will be transformed in a Center for Digital Health very soon. So hopefully we can have some joint projects with local companies and companies in UK as well.
Thank you, Professor. Andrew, would you mind sharing your comments with us?
Thank you, Neha. Look, when it comes to us at My Way Digital Health, I think there's a lot that we and others actually in the UK can do to support various ventures at both a national level and not just around the pandemic. In terms of My Way Digital, what we do is we run national diabetes platforms in Scotland and England, and we would have significant experience to support a national data-driven approach to diabetes, and not just diabetes, but other long-term condition management. This would include strategies around COVID recovery, patients triage, and risk prediction to help with the COVID backlog and the planning, and basically remote monitoring services to help with at-home care. So I think there are a number of ways that we can work with data sharing and analytics. On to you, Neha.
Thank you very much. With bearing in mind the time, we're going to have to very sadly draw these proceedings to a close very soon. But if any of the panelists have any questions for each other, I'm quite happy to open the floor for cross conversation if any of the panelists would like to ask or even seek help, assistance, etc. from any of the other panelists. Would anyone like to engage quickly?
I'd like to.
Go ahead.
Sorry to say, I've sent a couple of private messages. Some of the things that I've heard today are really useful. We'd love to work and replicate the model that we have in the UK and the US in Malaysia. So made some notes of some good connections, and anybody feel free to connect with me after the call. And I don't know if you guys can circulate the email addresses so that we've all got each other's contacts.
I'm sure the CWEIC team would be happy to do that shortly after the call. Anyone else?
Yeah, just
go ahead.
We would like to work with more Malaysian companies. At the moment, we are working with a few of them, but we need to have more partners in Malaysia first. In UK, we already have a few, but we need to have more students in order to develop our connections. But in Malaysia, yes, first, and UK then. Yeah, please. Thank you.
Wonderful. Anyone else? Okay. Go ahead.
Yeah. How do we? This is the first meeting, I presume. Is there going to be a second one for us to further interact and kind of engage again? Because obviously, from today, there'll be some take-home lessons that we can think about. Definitely, I think it's a boost for all of us in Malaysia to work with international companies in the UK, because you have your unique experiences, and there's a lot of things that we need to iron out, especially where the government sector is concerned. So those success stories in UK, perhaps the way they deal with the government, there's some ways that we need to emulate in Malaysia as well. I stand to learn from all this, and it would be good if we can have further stakeholder engagement regarding all the matters we discussed today. Thank you.
That's a good point, and I'm certain that the CWEIC team will take that on board and plan something to follow up. If not in a forum of this nature, at least in a private setting. There's a number of interesting comments have been made, observations have been made, specific needs have been raised, and opportunities for introduction and collaboration have also been forthcoming. So I do encourage you all to reach out to each other, interact with each other, support each other in whatever ways in which you need. But sadly, our panel discussion today has to draw to a close, and I take this opportunity to thank each of the eminent panelists today for their participation, and I hope that you all found the discussion to be engaging. As I mentioned earlier, the colleagues from the DIT network in Malaysia and the UK will follow up with you and stay connected. We hope that this was merely the start of the conversation, which potentially ends in you visiting the UK and the West Midlands during the Games in Birmingham. I'd also like to thank the team at CWEIC, the DIT, and of course all the participants for joining today. And we look forward to the next discussion. Thank you all very much. Bye-bye.
Thank you.
Thank you, everyone.
Thank you.
Thank you.